I'm from Birmingham, and crossing a postcode sort of decreases your life expectancy by 10 years. And that sort of kind of clicked in my mind that this is quite a big issue affecting quite a lot of people. How can we solve this? Being part of the NIHR felt like a way to get to that point.
Absolutely everybody should have an opportunity to be healthy, but not everyone is in a position to be able to do that. We're working in quite a complex world, and we're not going to find a one-size-fits-all solution.
There is a very specific issue or specific experiences which different people from different cities and areas of the UK experience vastly differently. Public health research isn't just about data collection, right? It's about finding a solution to the problems people and communities experience every day, finding those lived experiences and creating a solution, creating a question to tackle that.
Everything changes very quickly, so we always have to be responsive to that and researching what works. People who work in public health can be quite stubborn in that respect. We don't give up.
NIHR talked about prevention and public health research as being one of its long-term goals. The way we've taken things forward is to focus very much on these wider population health impacts and the wider determinants. The big drivers of health, like housing, air quality, pollution, transport, the built environment, climate change. One of the things that is unique about NIHR is that it's doing work across the whole spectrum of public health, from commissioning research studies to providing research support to people, to developing capacity in public health research, to developing the next generation of public health research leaders.
The beauty of the NIHR is it brings together people from all across the sort of research world. So you've got people working in local authorities, people who make commissioning decisions, you've also got national policymakers, and then you also have local communities who are going to be impacted by the decisions as well, and all discussing what might the impact of this research be.
It's about having impact ultimately on population health and inequalities, but the only way to do that is to have research that makes sense to people in terms of what they're trying to achieve and change locally or nationally.
Being able to actively find a solution and then work with policymakers and work with decision makers, translate that solution into an actionable thing is what I found research to be so good at doing.
People should care about it because we're looking at commissioning research in areas that really matter to their health. When we commission work on air quality or housing or climate change, it's because these are the things that are impacting most on people's health.
NIHR provides evidence, helps really guide some of those decisions so that you can make sure you're investing in something that's going to be effective for your local community. It's a difficult time in the country at the moment, in the world at the moment, and I think having the NIHR here, providing the funding so that independent research can take place, and sort of the evidence and the scrutiny of what's happening is really important.